We are condemned to useless labor.
Fourth circle of hell. Charting goes a lot quicker when you eliminate all classic poetry.
Writing down what we already know to be read by nobody. I'm pretty sure Dante would agree that qualifies as useless.
You're over 2 weeks behind.
What are you, 8?
Could an 8-year-old do this?
Stop, or it'll stick that way. You have a patient on one.
Melancholy without hope. Which circle is that?
First,
Is first better or worse than the fourth?
better.
Thank God. I'm Dr. House. What seems to be the problem?
Show him your hands, Augustine.
It looks like stigmata.
Shh, Pius.
You must all be the talker in the holy water cooler. Been watching a lot of dishes recently?
I help out in the kitchen.
Anything new in the kitchen?
We just got a donation of saucepans this week.
I unpacked and washed them.
You should have spent your time saving souls. Easier on the hands. This is allergic reaction dermatitis.
It's nonsense. We always use that soap. Why is there a problem now?
I've been a doctor for years. Why do I keep reassuring people that I know what I'm doing? A person can become allergic to substances they've had repeated and prolonged exposure to. I know, talk about mysterious ways. The good news is, free samples. Diphenhydramine. It's an antihistamine. It'll stop your allergic reaction. Take one every 8 hours. It'll make you a little sleepy. And get some over-the-counter cortisone cream.
Thank you, doctor. Could I have some tea?
Just relax for a few minutes. The stuff works pretty quick.
Doctor, I want to thank you for your patience.
Is he talking to you?
It's good to get secular diagnosis. The sisters tend to interpret their illnesses as God's will.
And you don't? Then you're wearing a very funny outfit.
If I break my leg, I believe it happened for a reason. I believe God wants me to break my leg. I also believe He wants me to put the cast on it.
Doctor, something's wrong.
So you made the diagnosis of allergies and prescribed an antihistamine, and then she went into respiratory distress, and you injected her with 1 cc of epinephrine.
0.1 cc. That's the standard dose. That's what I gave her.
People don't go into cardiac arrest from 0.1 cc of epinephrine.
Healthy people don't. She must have an underlying heart condition that got exacerbated by the epinephrine.
Too bad you didn't make a notation in the chart.
I can make it up right now.
The drawer has syringes with both dosages in it. It could have been easy to reach for the wrong.
But I didn't.
Everyone makes mistakes. That's why doctors pay through the nose for malpractice insurance.
Relax. They're not going to sue. Worst they'll do is whack my hand with a ruler.
And the discipline board, are they going to whack your hand too?
You're going to report me?
What choice do I have?
How about not report me?
Why? You flaunt the fact that you use drugs.
Make the pain in my legs go away and I'll stop using painkillers.
Your records suck, you're on drugs, and you're an ass. Why do you expect anybody to give you the benefit of the doubt? I can justify keeping her here for a 24-hour observation. If you haven't found an underlying cause by then, I'll have to notify our attorneys.
The lady just came in with a rash.
What the hell are those?
Candy canes.
Candy canes? Are you trying to mock me?
No, it's Christmas.
Relax. It's a joke.
If it was any other attending doctors, I'd say he made a mistake and give her too much epinephrine.
Saying you wouldn't say it was my mistake is saying it was my mistake.
Everyone screws up. Your rule. I think you fit in within the subset of everyone.
I didn't screw up. Order a chest CT and start the sister on 40 mg TID prednisone.
The sister?
Oh, didn't I mention? The patient's a nun, Sister Augustine.
I hate nuns.
Who doesn't?
The patient tested positive for herpetic encephalitis.
What's that tell us?
Her immune system is severely compromised.
Hey, I know. Prednisone compromises the immune system. Isn't that the medicine you gave her for that thing she doesn't have?
I'm thinking that's a trick question.
Her immune system is severely compromised. 2 doses of prednisone wouldn't do that.
You're hanging your diagnosis on an adverb?
In 10 seconds, I'm going to announce that I gave her the wrong dose in the clinic.
You're going to admit negligence?
Unless you leave the room. If you stay, you'll have to testify. 5 more seconds. 4, 3, 2. So, what are our options for compromised immune system?
Mixed connective tissue disease.
That would explain why she was feeling better on the prednisone.
Yes, she was feeling better right up to the moment it almost killed her.
On the other hand, it explains the symptoms. Swollen hands, pulmonary problems, cardiac problems. It all fits.
Well, except her ANA was normal.
It may not show up at first.
Redraw the blood.
But the treatment is corticosteroids, prednisone, and we can't go there because of the encephalitis.
3 times you deny me, Foreman. We'll treat her with something that modulates the immune system and doesn't suppress it. The hyperbaric oxygen chamber.
There is no protocol for putting a patient into a high-pressure oxygen room to treat an autoimmune problem.
There have been experimental trials using hyperbaric medicine on Menisthenia gravis. They've also used it on mice with lupus.
Mice with lupus? Why not go with leash therapy? It's been shown to be effective on snails with Parkinson.
Prep the patient and discontinue the prednisone. I both admire and am annoyed by the fact that you think that I should be less stubborn than you are.
Hyperbaric treatment could cause oxygen toxicity, lung and eye damage.
Every treatment has its dangers.
Which is why we only treat patients if we're convinced that they need treatment.
I'm convinced. You're not. Question is, what are you going to do about it?
I've got an opening on Thursday at 3. Do you have a 4th? Is he any good? I'll have to call you back.
I need to talk to you, Dr. House. I think you might have made some serious mistake.
Take a number.
Sister Augustine believes things that aren't real.
I thought that was a job requirement for you people.
She's been known to lie, to get sympathy. She's a hypochondriac.
So you're telling me I may be treating a non-existent ailment?
Sore throats, joint pain. There is always something wrong, and there is never reason. Mother Superior plays right into it. Lets Augustine off work duties. Considers her as a fragile or special.
That must make you angry.
It bothers me. It's not really in Sister Augustine's best interest.
Mixed connective tissue disease? Her ANA is barely elevated.
Thanks for checking up on her. It's good to know you've got me covered.
O2 sats are down to 83. She just came from the hyperbaric chamber. They should be through the roof.
She's only had
3 sessions, yes, and apparently they have not helped. They've done nothing but cause pulmonary and breathing problems.
irritation from the oxygen is typical.
She came in with a rash and you put her in cardiac arrest.
That well just never goes dry, does it? If there weren't an underlying problem, why is she still having rapid heart rate?
Maybe it's from the herpetic encephalitis caused by you giving her prednisone.
That is a symptom, not an error.
There's always an explanation, isn't there?
Yes, there is one. And if there isn't one, then we'll just find another.
But never one involving you screwing up.
One that fits all the facts. Look, we obviously have a difference of opinion, which is fine. But unfortunately, I've used up all the time I had budgeted today for banging my head against a wall.
I'm gonna do you the biggest favor one doctor can do for another. I'm gonna stop you from killing your patient. You're off the case.
He texted me saying my mother was here. My mother's been dead for 10 years.
And yet she's always with you in spirit. What do you know about the nun?
Which one?
The cute one. I think she likes me. The sick one, obviously.
Her parents were killed, and she moved to the monastery when she was 6.
What's she lying about?
Why do you say that?
Because I always say that. The angry priest thinks the sick nun is a big fat nun liar. You know nuns. Do you believe her?
I don't know nuns.
You hate nuns. You can't hate someone unless you know them.
Know any Nazis? Maybe I hate them on principle.
I have a theory on what makes good boys good. It's not because of some moral imperative. Good boys are good because they have the fear of God put into them. The Catholic Church specializes in that kind of training. To make good boys afraid of divine retribution so that they'll do what their daddies tell them. Like going to medical school when they know that's the last thing that they want to do. What do you think?
I think if she does have a secret, her boss would know.
God?
No.
Any change with the medication?
Yeah, she's getting worse. Lung functions are deteriorating. BUN is still climbing. She's starting to run a fever, and the rash is getting worse. At this rate, she'll be dead before Christmas.
Maybe House is right. Maybe there's an underlying condition, something causing all of these symptoms. Maybe something we haven't considered.
Like what?
Maybe a metabolic disorder.
Specifically?
Maybe something genetic.
Specifically?
I'm just saying maybe...
You're just saying you think House is right.
Might be right.
Of course he might be right. It might be the hand of God at work. Don't say it's something else unless you've got something concrete to offer. Well?
I'm going to do you the biggest favor that one doctor can do for another. I'm going to stop you from killing your patient.
What is this, hemlock?
Actually, it's figwort tea. Great for giving you that little pick-me-up we're all looking for in the morning. Unfortunately, one of the side effects is if you drink it and then get injected by 0.1 cc of epinephrine, you've got instant cardiac arrest.
Sister Augustine.
Has been drinking it religiously, so to speak.
And if you take the cardiac arrest out of the equation,
All of the rest of the other symptoms can be explained by the prolonged allergic reaction.
that's what Cameron said in the beginning.
Yes, she did. Well done. But your unwillingness to stick to your diagnosis almost got this woman killed. So, take a lesson from Foreman. Stand up for what you believe. Come on. Let's figure out how to go save a nun.
Damned if you do, damned if you don't.
There you go. No televisions, no books.
Not even a Bible.
I'm afraid not. This room has filtered air, filtered water. You even have silk sheets, very decadent, but hypoallergenic. You should be feeling better here.
We'll be back to check on you in a little while.
Can Father Theo and Sister Pies pray with me?
No. I'll pray with you.
We'll let you know if there's any changes.
Will she be alright?
As long as she's not exposed to anything that can aggravate her allergy, she'll be fine.
I need help in here.
Anaphylactic shock? How do you get an allergic reaction inside of a clean room?
Maybe it was the preservatives in the IV.
Check that.
Latex tubing.
Check that.
Breach in protocol.
We checked everything. Checked and rechecked.
It can be mast cell leukemia. It can cause anaphylaxis.
We checked the blood levels. And no, it's not eosinophilia or idiopathic anaphylaxis.
Maybe it's just divine will.
It's not my will.
You do realize, if you're wrong about the big picture, that is, you're gonna burn, right?
What do you want me to do? Just accept it and pack it in?
I want you to accept that sometimes patients die against all reason, and sometimes patients get better.
No, they don't. We just don't know the reason.
I think the nuns would agree with you on that one.
I just want you to know, I know you did everything that you could.
Why did you want to say that?
Because, well, I know.
I don't need any verification from you to know that I'm doing my job well. That's your problem, not mine.
I was just trying to be nice.
Yeah, you don't always need to do that.
Merry Christmas.
Sister Augustine's being extubated.
Good.
She's requested to check out against medical advice. She wants to go back to the monastery.
And talk her out of it.
I think I talked her into it.
Then you can definitely talk her out of it.
I don't want to.
So you are a believer.
No, but I know that not believing is a lot more painful.
Your room's all paid up for the rest of the week. You might as well stick around.
This illness, it's a test of my faith. If it's His will to take me, it won't matter where I am. I can accept that.
Does anybody believe anything you say? You're not accepting. You're running away, just like you always do. You ran away from the monastery to get laid. You ran away from the real world from getting laid because getting laid wasn't working out for you. And now things aren't working out for you now. And now off you go.
Why is it so difficult for you to believe in God?
What I have difficulty with is the concept of belief. Faith isn't based on logic or experience.
I experience God on a daily basis and the miracles of life all around. The miracle of faith, the miracle of love. He's always with me, inside of me, inside all of us. He's everywhere.
Yes, but this is where he keeps his medical supplies. You want to live? You got a better chance betting on me than on him.
When I was 15, I was on every kind of birth control known to man, and I still got pregnant. I blamed God. I hated him for ruining my life, but then I realized you can't be angry with God and not believe in him. No one can. Not even you, Dr. House.
You're not listening to me. God is not going to save you.
You're not listening to me. I don't believe he's inside me and he's going to save me. I believe he's inside me whether I live or die. There is a difference. Thank you for your help. You'll be in my prayers.
How'd it go?
God's inside her. A tumor would have been easier.
Maybe she's allergic to God.
No fillings, no piercings, no surgical pins in the arm, no implants.
Clean as a whistle. What's House looking for?
Hey, what's that?
I don't know.
Lock on it and get a 3D representation.
Oh my God.
The copper T, an IUD pulled off the market. Pure copper. In med school, I used to make earrings out of these things for my girlfriends.
So she's allergic to copper.
Rare, but it happens.
Wouldn't she know if she had an IUD?
She had an abortion. The IUD must have been left in, embedded in the endometrial tissue where it couldn't be detected.
So all we have to do is remove the IUD.
Duh.
So once we remove the IUD, all your symptoms should subside.
But I got that IUD when I was 15. It's been years.
The body can only handle prolonged exposure to an allergen for just so long. It's like a balloon when you fill it with air. All it takes is one last breath and it explodes.
When I first got the rash, it was from washing the copper cookware.
And your symptoms came from ingesting food from it.
Dr. House found his miracle.
I doubt he's going to see it that way.
Sixth circle of hell.
Confined to a sweatbox with a bloody nose and all the tissues are soggy.
I think that's the seventh.
Nope. The seventh is.
You must be fun at parties.
I think we both know the flaw in that theory.
How's his sister doing?
4 hours after we removed the IUD, her skin rash started clearing up, her heart rate normal, kidneys functioning. At this rate, she'll be home in time for New Year's, barring an intervening rupture.
Great.
I told you I didn't screw up.
You screwed up.
I gave the nun a 0.1 cc of epinephrine.
And you would have killed her if Cuddy hadn't pulled you off the case. You want to come over for Christmas dinner?
You're not Christian.
Chris Mahana Kwanzaa then. What do you care? It's dinner with people.
No thanks.
Fine. I'll come over your place then.
Your wife doesn't mind being home alone on Christmas?
I'm a doctor. She's used to being alone. I don't want to talk about it.
You did good with the nun. Congratulations.
Thank you.
Merry Christmas, Dr. House. Dr. Wilson.
That was sweet.